Do you ever get the feeling when rich people suffer, it's easier? I mean, suffering is suffering, isn't it? I agree. Yep. But don't you think it's just a little bit easier when you're rich and you suffer? Let's look at it this way. Let's say somebody is rich enough to afford private healthcare, ensuite room, service at the tinkle of a little bell, best quality food and everything, private hospital, best treatment there is, surgeons and doctors on tap 24 hours a day, every day of the week. Yeah? And let's imagine they are being treated for cancer. Yeah? I know they'll suffer. No question about it. They will suffer. Thank God I have not had cancer. I have been, of course, treated for various other things in hospital. Yes, of course they'll suffer. If they go through a course of chemotherapy, I imagine they will suffer just as much as the person in a bed in an NHS hospital in terms of the quality and the actual nature of the suffering. But don't you think that having that little bit of extra money is going to get them that little bit better service? And it's going to get them to a stage where the nurses and whatever, there'll be enough of them to deal with the patients. They'll be able to get there on time. They'll be able to do their job properly as nurses. And there'll be enough medical staff and professionals around and whatever to do all they can to help at least alleviate this person's suffering. At least if they can't cure them, and let's face it, unfortunately, not all cancers can be stopped or controlled. We know that. But this rich person in bed, in this private hospital, it's going to be, well, I think, qualitatively, just a little bit better off. I begin by saying that because I'm going to comment on something else in a moment. And really behind that is Save Our NHS. Save Our NHS. Tory vulture capitalists, as you can see. Tory vulture capitalists profit as we suffer. They profit as we suffer. Let me read you something written by somebody in an NHS hospital this morning. My heart absolutely goes out to them, but I'm not going to give many identifying details of where this person is. Just let me read it to you. I'm sick again. Readmitted with an infection. Came in 4 hours ago. Just got antibiotics now. Still no pain relief. Thank God for the bed and the jug of tepid water. I'm sick. Sick of the pain. Sick of the piss and the shit. Sick of waiting 30 minutes for someone to help me with my soiled bedding. Sick of watching a hapless idiot try to put a cannula in and pierce everything but the vein. Sick of being told that the success of my recovery is predicated on my character and that anything that goes wrong is down to flaws in my character, which, to be honest, border on mental illness. My vomiting. So I'm told because I'm pathetic and I should be able to keep my meds down. Sick of being sick. Most of all, and here's the bit where I think it really says a tremendous amount. Most of all, I'm sick of living in a shit country with a government hell-bent on destroying the health service in order to open the market to big business. I'm even more sick, and even more sick-making are the number of people suffering as I am who can't make the connection and keep voting them back into power. The government care nothing for ordinary people. Let's stand together until we rid our country of these people, these Tories and their hateful policies. I've already posted to that particular person my thoughts for them and my sense of human compassion, if you like, sending positive vibes. One thing that strikes me in that is that although this person is obviously in a great deal of pain, yeah, they're still determined to fight. They're still determined to fight for the Tories, to fight for our NHS, yeah. That is fantastic. But just imagine that situation for a moment, if you would. I began by talking about the people with the private healthcare, the people that will be able to afford it, the people who will still suffer. I'm quite sure there could well be private hospitals in which people are suffering the exact same symptoms. I'm absolutely certain that there are private hospitals where the suffering is the same. But think about it. Why is it taking so long to get pain meds sorted out for this guy? Why is that? Why is it taking so long? Probably because the hospital doesn't have enough doctors on call able to deal with the administration of that strong medication. I've been on pain relief medication before. I was on morphine when I woke up from my heart surgery, my CBAC surgery. And yeah, it hurts like hell, yeah? And actually, even morphine doesn't necessarily take it away straight away. I don't know about you, but sometimes when you really hurt, you can start feeling physically sick as well. Just imagine what the Tories are doing to the NHS. They're cutting it back. Nurses are eating from food banks. Do you honestly think that if that was Prime Minister Theresa May or Bojo Boris Johnson or some corporate rich kid, yeah, they, as a human being, would be waiting that long for just something to ease their suffering, something to ease their pain? Of course they wouldn't be. This is not knocking our NHS, right? This most definitely is not. I am absolutely convinced that our NHS is made up of fantastic professionals and nurses and doctors who constantly work to keep their patients out of suffering and to make them better. I'm absolutely convinced of that, and I am equally convinced that our NHS works the way it does because of the goodwill of these people. These are not nurses who go, oh, it's past my shift now, you'll have to start paying me overtime, or halfway through dealing with this patient, I'm going to leave. Yeah? They don't do that. Of course they don't do that. They're amazing people, and the NHS is made up of them, but they're eating from food banks. I am as sick, although I'm not physically in the pain that he is in, I am as sick of these people softening up our NHS for full privatisation as that person is. I'm sick of it. I'm sick of waiting on a telephone for somebody from mental health services to deal with my wife when she's having a psychotic episode. I'm sick of it. I'm sick of people from the DWP then deciding that somebody like that really is going to get better, and after all, shouldn't they get a job? Yeah? I'm sick of it. I'm sick of being punished by this government. I'm sick of this government destroying our society. I'm sick of the brutal world they create for others so that the richest and the strongest can get richer and stronger. Please, do something about this. This person in their suffering in that hospital mentions, why? The people suffering as they are, as we are, why do they elect them again? Why do they vote them in again? Why, oh why, oh why? We have constantly got to be active on social media to show people that they're being propagandised by the Tories. They're being lied to. Remember? And the single that was out, Captain Scar, she's a liar, liar. Well, in that, one of my favourite lines is, I don't want a government, something along the lines of, I don't want to live with a government that thinks that fascism is where it's at. Don't want to live with a government that thinks that fascism is where it's at. Yeah. And what could be truer? She says she doesn't recognise her own country. I don't recognise it either. It's full of policies perpetrated by vicious, hateful, elitist, billionaire Tories who really don't give a toss about ordinary people. They see us as a resource to be exploited. If I were to have another heart attack and die, they'd genuinely be pleased, because that would be one less strain on the public purse. I urge you, please, not only to kind of send good vibes to this person and everyone trying to look after them in hospital. If good vibes work, well, send them, please. I mean, yeah, I'm a Christian. I also will pray, but I won't just kneel on my knees and pray. I'll try and do something as well, of course. But maybe one of the things I can be doing is to say to you people, get the Tories out. Get them out. It doesn't necessarily mean that, everything is going to be instantaneous in an NHS hospital. Of course not. It never has been. It never will be. It never can be. I understand that. Yeah. But when you get the ambulance service cut back, and we hear stories of somebody waiting 4 hours for an ambulance. 4 hours for an ambulance when I had my heart attack, and I would have been dead. Yeah. It's not the fault of the service providers. It's not the fault of our nurses and doctors and ambulance personnel and emergency services. It's not their fault. It's the fault of allowing these billionaire tax dodgers to get everything and not giving to our health service and all our public services the funding and the help they need, they must have. Anyway, look, I hope you'll just take this and forward it and post it, because that really matters to me. I still have that image of this person now, and it's in my head. It really is deeply in my head, and I would ask you to think, please, please think, what if one day that is you? Your mum, your dad, your relative, your son, your daughter, your friend, your workmate. What if that is you? How are you going to feel about the Tories and what they're doing then? Thanks for listening. As I say, please share.